Hi everyone, this is your At the Bedside Case of the Week. This is a 64-year-old female with a history of diabetes and hypertension who presents with left eye vision loss starting about 5 hours prior to arrival. Her vision slowly and painlessly faded in her left eye. No flashes, floaters, double vision, eye pain, or pain with eye movement, and no trauma. She's a little bit hypertensive with a blood pressure of 182/84. The rest of her vital signs are normal. Before watching this week's video, ask yourself, what's the differential diagnosis for unilateral painless vision loss? What are the 5 vital signs of the eye? And how can ultrasound help us diagnose ophthalmologic conditions? For any patient with a concerning eye complaint, your physical exam needs to include the 5 vital signs of the eye. These are visual acuity, intraocular pressure, the pupillary exam, visual fields, and extraocular movement. Use your Snellen eye chart to measure visual acuity. Our patient on the right was 20/100, and on the left she could only count fingers 2 inches away. You can use a tono pen to measure intraocular pressure. Our patient was 14 on the right and 14 on the left, which is in the normal range. Take out that pen light for your pupillary exam. Our patient's pupils were normal, round, brisk, and reactive bilaterally. Visual fields is next. There's great videos online to see how to examine them. On the right, they were full, and on the left, there were deficiencies in all fields. And finally, make that big H with your finger to examine the muscles of extraocular movement. Our patient was intact on the right and intact on the left as well. This is the must-do eye exam that you should be able to relay to your ophthalmologic colleagues if you call them. So what's your differential diagnosis for this patient? Remember, in the ED, we have to rule out can't-miss conditions. First off, there's central retinal artery occlusion, also known as cryo. This is a stroke of the eye. It's sudden and painless, less likely in our patient as her vision got gradually worse. Next on the differential, and along the same spectrum, is amaurosis fugax. This is like a TIA of the eye, often described as a curtain descending, taking minutes to hours, and the eye will return to normal vision, which didn't happen in our patient. Another possibility for us is central retinal vein occlusion, also presenting with painless vision loss unilaterally. On slit lamp, you'd see venous dilation and disc edema. Vitreous hemorrhage, often caused by poor vessel quality due to poorly controlled diabetes, is definitely a possibility. The vision loss can be mild or severe, and occasionally patients will see floaters or cobwebs. Finally, we have retinal detachment. Often patients will describe a filmy, cloudy vision. Now you've examined the 5 vital signs of the eye, and you formed your differential diagnosis for this patient. So, what's your imaging plan? Well, if you're concerned for any sort of stroke, such as a cryo or amaurosis fugax, that patient is going to need a CTA of the head and neck. They're going to need vessel imaging. They're also likely going to need a stroke workup inpatient and an MRI. Now, given our patient's history of terrible diabetes mellitus, as well as the fact that her visual loss was more gradual, I was more concerned for vitreous hemorrhage or retinal detachment. If you're concerned about these pathologies, bedside ultrasound is a great imaging plan that can help you narrow your differential diagnosis. So we actually did do a bedside ultrasound of this patient. On the left here, you can see a normal ultrasound of the eye with all the structures labeled. And on the bottom right, you can see the ultrasound of our patient. What's notable here is that they have an hyperechoic area within the vitreous body. Also note that it is not attached to the optic nerve. This is a common finding in an ultrasound of someone with vitreous hemorrhage. Important note here, vitreous hemorrhage can be differentiated between retinal detachment because the retina is always going to be attached to the optic nerve. So the diagnosis in our patient was vitreous hemorrhage. This is due to neovascularization from weak vessels due to poorly controlled diabetes mellitus. Now, what's the emergency department management of this condition? Well, all you have to do is elevate the head of the bed, and you're going to want to stop any sort of NSAID or anticoagulation, and definitely prompt referral to ophthalmology. So the takeaways from this week are the 5 vital signs of the eye are visual acuity, intraocular pressure, pupillary exam, visual fields, and extraocular motility. And ultrasound can be helpful in making the diagnosis of vitreous hemorrhage and retinal detachment when someone presents with unilateral painless vision loss. We'll see you next week.